Hello folks, today we will be talking of Otic Ganglia, which is another parasympathetic ganglia that we are going to talk of. So Otic Ganglia is the parasympathetic ganglia like the one we have already talked of, that is your ciliary ganglia. So it's the another type of parasympathetic ganglia. So the shape of this ganglia is it's oval shaped, size with measuring 2 to 3 mm. Now the important thing over here is that topographically this ganglia is related to what, and functionally it is related to what. So topographically this ganglia is connected to the mandibular nerve, which is the branch of your trigeminal nerve, right? That is your fifth nerve. So topographically it is connected to the mandibular nerve, but functionally this ganglia is connected to your ninth nerve, that is your glossopharyngeal nerve. So these 2 points over here is very important regarding the otic ganglia, that is topographically it is connected to mandibular nerve and functionally it is connected to the glossopharyngeal nerve. Now talking of the location of this ganglia, so this ganglia is basically lying just underneath the foramen ovale, that you will see at the norma basalis, that there is a foramen ovale through which are structures male that you must have remembered from your classes, that is mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. So these are the structures which passes through your foramen ovale, and the ganglia is lying just below this foramen, right? And talking of other structures, so medially you are going to see a nerve, that is the trunk of mandibular nerve, which is already coming out of this foramen ovale. Laterally there is a muscle, that is tensor villi palatini. And if we talk of in front and behind, so in front you are going to have the artery, that is middle meningeal artery. So in the front there is a artery, middle meningeal artery, and just behind you will have the muscle, that is your medial pterygoid muscle. So these are the structures related to this ganglia over here, that you have the mandibular nerve on the medial, laterally you are going to have tensor villi palatini, and in front you have the artery, that is middle meningeal artery. Behind you have your muscle, that is the medial pterygoid. So this ganglia is basically surrounded by the nerve that is supplying your medial pterygoid, that is nerve to medial pterygoid. So it is surrounded by the nerve to medial pterygoid. So these are the connections, or you can say these are the location where the foramen ovale is located and relations with the structures which are lying over there, right? So now we will be talking of very important thing over here, that is the connections. So every ganglia, parasympathetic, every ganglia is going to have the connection, but in the otic ganglia the thing which is very important is that we have 4 roots over here. So first of all we have the parasympathetic root, then we have the sympathetic root, then we have the sensory root, and lastly we have the motor root. So there are 4 roots which are connected to your otic ganglia. So we will be talking of these roots one by one. So taking up on parasympathetic root first of all. So the fibers from the parasympathetic root originate from the nucleus, which is lying in the medulla. So in the medulla you have a nucleus which is named as inferior salivatory nucleus. From there the fibers are going to originate. The fibers are going to pass through your ninth nerve, as we have talked that it is functionally connected to this nerve over here. So it will pass through the ninth nerve, and from there the fibers are going to enter into one of the branch of your glossopharyngeal nerve, that is your tympanic branch. So it will pass through the tympanic branch over here, and it will then reach the tympanic plexus. So the fibers, after reaching the tympanic plexus, will go towards another nerve, that is your lesser petrosal nerve. This lesser petrosal nerve will come out of this foramen, which is your foramen ovale, right? So it will come out of foramen ovale, reaching up to the otic ganglia, and it will relay over here. This is important thing that you will be learning in parasympathetic supply or the root of your otic ganglia, that it is relaying in the otic ganglia, and then after relay the post ganglionic fibers are going to originate from the ganglia and are carried to the parotid gland via auricular nerve. So this auricular nerve is the branch of your mandibular nerve. So as we have talked, topographically it is connected to the mandibular nerve. So now you can see how topographically this ganglia is connected to the mandibular nerve, and functionally it is carrying the fibers of the glossopharyngeal nerve. So after relaying, it will pass towards your parotid gland, supplying the secretomotor fibers, right? So it will start from the medulla. Fibers are carried by glossopharyngeal nerve, then the tympanic branch reaching the tympanic plexus, then via lesser petrosal nerve it will reach your ganglia, relay over there. Post ganglionic fibers will pass through auriculotemporal nerve, reaching your parotid gland, supplying the secretomotor fibers, right? So now we will talk another root, that is your sympathetic root. So for the sympathetic root, the fibers are originating from lateral horn of your T1 segment. The fibers are originating from this segment, and it will go upwards, that it is ascending upwards, relaying in the ganglia, that is your superior cervical ganglia. So this is the ganglia where the relay has occurred. The fibers after that are your post ganglionic fibers, right? So after relaying, they will pass along with the plexus, that is around your middle meningeal artery, right? Then this fiber will go into the otic ganglia, where it is not going to relay. So no relay is going to occur because the relay has already occurred in your superior cervical ganglia. So the fibers will pass through the otic ganglia without interruption, and via auriculotemporal nerve it will reach your parotid gland, supplying the blood vessels of the gland. So this is your sympathetic root of the otic ganglia. Then we will take upon your third root, that is your sensory root. For the sensory root, the fibers are taken from the gland, pass through your auriculotemporal nerve without relaying. So no relay is going to occur. Without relaying through the otic ganglia, it will reach your higher center, right? So this is the sensory root. So lastly, we will be taking off our motor root, right? As we know, we have 4 roots. So lastly, we will be talking of the motor root. So for the motor root, as there is a muscle, we have talked medial pterygoid, and the nerve to medial pterygoid is arising from the trunk of your mandibular nerve. So from the trunk, the fibers are arising to supply the medial pterygoid muscle. This nerve is called nerve to medial pterygoid. So this nerve will pass through your otic ganglia without any interruption. Without interruption, the fibers will pass through it, supplying 2 muscles, that is your tensor villi palatini, and second one is tensor tympani. So this is the motor route. Without interruption, it will supply the two muscles over here, right? So these are the roots and your otic ganglia that we have talked of. Thank you so much.